Well guys, believe it or not, doctors in this country have decided to stand up and speak out. Though not on the things they should be, it is still something after all. This time it's in relation to the planned data grab by the NHS that will see every bit of medical information stored in one place. All 55 million people in England's medical information, that is, which private companies working with the NHS can access as they want. This is obviously concerning, as is the ease with which data can be stolen if it's stored in just one location. I don't need to point out how much of a massive security risk it is, and the doctors are saying that also, with even some now coming out and saying they will refuse to hand over patients' medical records to NHS Digital, which is what the service is called, when they demand it on the 1st of July. Chances are you actually didn't know about this, but yes, it's happening on the 1st of July this year, so you've literally got less than a month to actually get it done. Well, technically you've got about 20 days as it stands. Now, you can opt out of it, but from my reading of the opt-out website, there is a backdoor for them to use it anyway under the coronavirus laws, which means the GP standing up here is actually a good thing. Apparently, every GP in Tower Hamlets will refuse to hand over patient details, with others expected to follow suit. Now, usually doctors are moaning about money or something like that, trying to attack the government for whatever reason they can. This, I actually stand with them and think is actually a good thing for them to be doing. It's certainly not something we've been able to say recently, that is for sure. But the Express is saying doctors believe the automatic siphoning of NHS medical records, including details on mental and sexual health, criminal records and more, will undermine trust between patients and their GPs. Which of course it might well do, but never mind that. Why are they doing this is the question we should really be asking. Seems to me like it's part of a push for some sort of social credit system in the future. It goes on, no, our issue here with this particular proposal is that it's been rushed through. There's been no public information campaign to inform the public about the plans, and in order to allow them to decide for themselves whether they are happy about it. Which, to be honest, I actually agree with 100%. Many people do not know about this and won't ever because the media don't report it enough. And of course, social media sites like YouTube limit the views of people who might bring attention to it. As some might have noticed, YouTube recommending channels that are not the mainstream media or its shills has vanished like a fart in the wind over the past 15 months. But essentially, this video was to just bring attention to the fact that the NHS are doing this and give you the opportunity to opt out if you want to. For those who have not done it, the deadline to opt out of this data grab is actually June 23rd, 2021. So technically you've only got 19 days, not the 20 I said earlier. But if you decide to remove yourself from the database, you'll need to fill out a form and submit it to your GP. If you don't do this before the deadline, your medical records will become a permanent feature of the NHS Digital database. Opting out after June 23rd will still work, but will only apply to future data. Any historic data will still be available to researchers, academics and commercial partners of the NHS. Obviously, if you don't mind them having this information, then you don't have to do nothing and it will be automatically included for you. For those who don't want to be part of it, the form itself will be linked in the video description, along with my other social media channels and my new website. You can check them out after you've filled out the form if you have not already. Oh, and another thing guys, I will try and do a live stream tonight, so look out for that if you have the time. I'll keep you updated on when it will be if I myself actually have the time to do it.